Well, thank you very much indeed for asking me to speak. As you can see, I've changed my title slightly just to get a bit more focus on what I think the issues really are. We do need to act really urgently in order to protect not just the health of people today, but also the health of future generations. In the previous session, a number of people referred to Tony McMichael, and I wanted just to say a very brief testimony to Tony's extraordinary career. He died just a couple of weeks ago, and he's left a tremendous sense of loss amongst those of us who worked with him over several decades. He was an epidemiologist of great technical ability, but also of great vision, and one of the first people to really document how climate and other environmental changes can impact on human health. So he's someone that I know we'll be reading quite a lot about him in various journals over the next few weeks, but he's someone whose work will be not forgotten and will live well beyond the next few decades, I believe. So there are many pathways by which climate change may affect health outcomes, and I'm not going to be comprehensive because we've had a very good session before this in which quite a lot of detailed information was presented. So I'm going to give a kind of overview. And what this slide shows is that there's a whole range of mechanisms by which climate change can affect human health, ranging from the obvious, the direct ones that we're quite familiar with, to the less direct ones. And some of those less direct, or tertiary effects, as some people call them, may be more important in the longer term than some of the more direct effects that we understand much better today. And it will depend very much on how society adapts. So to some extent we can adapt to some level of climate change, but as I will mention later, there are some things we can't adapt to. And we're talking about climate change today, but there are many other environmental changes going on which will interact with climate change. Things like ocean acidification, or nitrogen loading, loss of biodiversity, and so on. So let's start the simple effects. Let's start with heat. I think many people know about the heat wave of 2003, probably 70,000 deaths. Perhaps what's not so often appreciated, and it's shown in the bottom of this slide, towards the bottom corner of the slide, is that that black line is the temperature, the average European summer temperature. And what you can see, the red line shows you where that's going. And what it means is that within a few decades, the extreme temperature we saw in 2003 will become the norm. So populations may be able to acclimatize to some of that, but certainly not all. So we are heading into a kind of uncharted territory. And as was mentioned briefly in the previous session, thermal stress also impairs our labour productivity, our ability to work in hot climates, particularly for those people working outdoors who are not in air-conditioned accommodation. And that will affect farmers, subsistence farmers around the world. And it's illustrated in this slide. The top, the green and yellow, shows you where we are now. And it shows you that on the vertical line you can see where there's some impairment of labour productivity. There's modest impairment at the moment in the summer months. But as we go towards 3 degrees or more of global warming, in the bottom part of the slide, you can see these red areas start to appear. And that's where we might have only, say, 20% or 30% of labour productivity in the summer months in years to come, with 3 degrees warming. By 6 degrees warming, then you pretty well eliminated the ability to work in the hottest months in many areas. So at some point you have to call into question the habitability of the planet under some scenarios of what we used to call extreme climate change, but I guess we'll be hearing from John Schellenhuber that some of these are all too probable if we carry on with our current trajectory. We're also seeing some extraordinary combinations of extreme events. So 2010, for example, the Pakistan floods, 20 million people affected. The Chinese floods, 12 million people displaced. And I think very significantly, the Russian drought and fires, not only were over 50,000 people killed by the heat wave in Russia, but very importantly, the wheat harvest was reduced by 30%. The Russians stopped exporting, and many people think that that was what caused many of the troubles in the Middle East as the bread prices went up, and that triggered civil disturbances. So this may be a warning of what is to come. There are a whole range of impacts, which I don't have time to go into, of extreme events, but just to touch upon some of the health impacts of floods. Obviously, we all know about the immediate deaths and injuries, but they're not necessarily the most dominant impacts. There's also infectious diseases, particularly leptospirosis, caused by walking in floodwater. Sometimes cholera and other diarrheal diseases, respiratory diseases caused by clustering together to avoid floods, and sometimes vector-borne diseases as well. But very importantly, economic losses are a major determinant of ill health, and some studies have suggested that the economic losses after floods can be almost as big an impact on health as the primary health effects. And in the long term, we see both with floods and with droughts, the effects on mental health. So often, for a year or more, high levels of depression, anxiety, behavioral disturbances in children, and sometimes suicide. Many millions more are projected to be flooded, not just by river flooding or glacier melting, but also by sea level rise. And this slide shows you what it might look like in the 2080s. The big red dots are where large numbers of people, more than 1 million people, might be exposed to sea level rise. And at the moment, that's projected to be around a metre or so by the end of the century. But obviously, if we get high levels of melting of ice caps, then that will go up very substantially. There's also the possibility of saline intrusion into fresh water, and some work Aneri Khan, a Bangladeshi researcher, has been leading in recent years, has documented the fact that many people are already drinking very high levels of salinity in their drinking water in coastal regions in Bangladesh, double the WHO, FAO recommended levels of salt for pregnant women. And a very recent paper that's come out just in the last couple of weeks, we showed that there are a risk of eclampsia, preeclampsia, gestational hypertension, which increased in a dose-response manner with increasing sodium concentrations. So people drinking from tube wells, for example, are taking almost 2 grams of salt a day just from their drinking water. Vector-borne diseases, I don't have time to go into detail, and there is a subsequent event this afternoon at which these issues will be discussed in much more detail. Dengue is one of the infections, the vector-borne diseases, which is most consistently related to climate change. And this slide shows you from Simon Hales's work, shows you that under some scenarios towards the end of the century, 50 to 60% of the world's population could be at risk of dengue, compared with 35% without climate change. And we know that dengue is a very major public health problem for many parts of the world. But it's probably nutrition which causes us our biggest concern. And we see also from the most recent IPCC report the observation that crop yields are going down at a time when the demand for food is going up by 14% or so a decade. This slide shows you, taken from a UNDP publication some years ago, where there's likely to be a decrease in yields, that's the red areas, and possibly an increase in yields by 2050. But once we go towards the second part of the century, even those high latitude areas where you see green increased yields, they may be threatened, and we may well see a decline in yields in some of those areas as well. And these are conservative estimates. They don't take into account the impact of pests, of weeds, of droughts, of other extreme events. They're just modeled on rather simple relationships between changes in climate and agricultural productivity. And they don't take into account what's happening in our oceans. Oceans are also under stress. They're overfished. We're seeing changes in fish distribution, with tropical fish moving to higher latitudes. And we're also seeing ocean acidification, which is causing weakening of the shells of shellfish and affecting the marine food chain in ways that we don't yet understand. So can we adapt? Well, we can adapt to some extent, but there are limits to adaptation. There are physical limits, such as small, low-lying islands or deltas, such as parts of Bangladesh. Behavioral limits. People want to live in the familiar areas, for example, in New Orleans. And technological limits. So the Thames Barrier, for example, will need to be revised later this century in order to cope with higher levels of sea. But as we've heard from the session earlier, there's also a positive side, and one which I think needs to be emphasized, because we know that trying to tell the public that there's going to be disaster ahead in decades to come does not necessarily motivate change. Sometimes it makes people turn away. They feel despair, they feel powerlessness, hopelessness. and it all appears too difficult. So it's important to have a positive message too, and the positive message is that if we do make the necessary changes, then the ancillary or the co-benefits will also bring us improvements in health in the near term. I don't have time to go into details, but there's a lot of work which I and many others have done in this area, looking at policies in a range of sectors: housing, transport, food and agriculture, and electricity generation. We've heard already that particulate air pollution is a major killer, perhaps 7 million deaths a year. Household air pollution, particularly related to the burning of solid fuels, either biomass, in some countries coal, particularly poor households. And, of course, outdoor air pollution, which is, again, coal-related, or diesel cars, for example, common causes of them. And ozone also makes a contribution as well. And, of course, methane, which is a shorter-lived climate pollutant, is a precursor to ozone. There are many new technologies for clean energy, and they have very major health benefits. This is one, solar concentrating power, where you focus the light of the rays of the sun on a central tower, which contains molten saline and then drives a turbine, generates electricity. And you can see in the bottom part of this slide that if we could place this kind of technology in deserts, we could, in theory, power or provide the world's electricity needs with relatively small surface areas. We focus a lot on reducing CO2, and reducing CO2 is absolutely essential because carbon dioxide remains in the atmosphere for a long time. It's essentially irreversible as far as our generation is concerned. 25% of it will be up in the atmosphere in 1,000 years' time. But there's also benefits from reducing some of the short-lived climate pollutants. Methane is one I mentioned. Ozone and black carbon is another one. And this work comes from the Climate and Clean Air Coalition, a UNEP coalition. And they've shown that in the near term, reducing these short-lived climate pollutants, as shown on this slide, black carbon, methane, can add substantially to the reductions that will be produced by CO2. Later on in the century, of course, CO2 becomes dominant. And so it's essential to reduce both carbon dioxide and the short-lived climate pollutants. And reducing the short-lived climate pollutants will produce health benefits. Here's some example of some of the things that could be done: improved biomass stoves, modern coke ovens, removing the heavily polluting diesel engines, improving brick kilns, reducing agricultural burning, and so on and so on. So these are all strategies that could be put in place now that would reduce black carbon and potentially avert 2.4 million deaths, many of them, most of them in low-income countries, but some in high-income countries too, as well as reducing at least the short-term pressure on the atmosphere, on the climate. There are many benefits for cities, for sustainable, clean, urban, well-planned urban environments. We've done work on urban transport, for example, showing that both reducing emissions, fine particulate emissions, and also promoting active travel can result in really substantial benefits in both a city like London, where the active travel advantages dominate, and a city like Delhi, where air pollution also plays a very major role in these benefits. And we've shown that the benefits far outweigh any negative effects from road traffic accidents. We've also shown that these kind of strategies would save money for our National Health Service, that's the NHS in this slide. And we've estimated perhaps £17 billion, so over $20 billion over a 20-year period, and going up after that time, because it's due to preventing conditions like diabetes related to sedentarism, some types of cancer, colon cancer, breast cancer, heart disease, stroke, dementia, and probably depression as well. So these, as I say, far outweigh any adverse effects from modest increase in road traffic injury. We have also done work, and others have done work, on the benefits of household energy, even in high-income countries. So the big benefits in low-income countries, but there are also benefits in high-income countries. In a country like the UK, much of our housing stock is inefficient, it's obsolete. In the thermal imaging photo there, you can see the orange areas where the heat is leaking out of the house. In the right-hand side, the house has been insulated, new windows, and better ventilation systems. And what we showed was that you could save perhaps 5,000 or avert 5,000 premature deaths a year and save 55 million tonnes of carbon dioxide by modernising the British housing stock over time. Diet and agriculture. We know that diet is an important contributor to greenhouse gas emissions. We can't ignore it. It's perhaps controversial in as much as trying to change the population's diet is difficult. But we do know that animals have a big carbon footprint, that particularly ruminants, because they produce methane, are major causes of global warming, of climate change, and so other types of animal products, less so, poultry particularly less so, but still much more than vegetables, which are much lower emissions. So having a balanced diet with less animal products could have a big effect, and some work we've just undertaken, we've submitted for publication, is looking at the impact of low-emission healthy diets in the UK. And what we try to do here is not just optimise or reduce greenhouse gas emissions, but try to keep the diet as close as possible to the current today's diet in order to maximise its acceptability and also to make it affordable to people. And what you can see on this slide on the vertical axis is the deviation from the current diet, and on the horizontal axis the emissions reductions. And what you can see is you can get up to about 40, perhaps 50% of emission reductions without deviating that much from today's diet. So you don't have to go completely vegan or vegetarian. You can reduce animal products, and that will reduce emissions quite substantially, improve health quite substantially as well, and we hope and think would be acceptable to the public. And finally, in conclusion, what about the role of the health sector itself? Well, the health sector is responsible for around about 4% of emissions directly within the European region. And also the health sector employs, of course, very large numbers of people. In the UK, for example, we employ more than 1 million people in our National Health Service, so they have potentially a lot of influence on a personal level and as health professionals. So increasingly in the UK, we're moving towards a health system which tries to reduce energy use and GHG emissions, increase resilience to floods and heat waves, and even in a country like the UK, about 7% of our hospitals are built on floodplains. And in many cases, the scanning rooms are in the basement, so the first thing that happens when you get a flood is the scanners get flooded, so the hospital can't be used. So even in high-income countries, we're not building climate-resilient health systems, reducing hospital admissions as much as we can, encouraging the use of public transportation, active travel by health professionals. And some hospitals are moving towards using locally sourced food and reducing animal product consumption in their canteen, and sensitising health professionals to this issue. So in conclusion, I would say that we are at a very dangerous point in history. We need to make decisions in the next few years that will protect the health, not just of current generations, but very importantly of future generations, our children, our grandchildren, and subsequent generations. If we don't do that, there will be catastrophic impacts on health. But the positive side is that many low-emission, low-carbon policies can improve health and the economy. And as we've heard in the previous session, the argument sometimes is that we can't afford to change. I think that argument now is losing its force. The IPCC have shown that the costs of change are very small. And if you take into account the health and other co-benefits, these in many cases outweigh the costs. So we need to make this case to policymakers that we can't use the argument it's too expensive, too difficult anymore. It can be done, it must be done, and it will be done. Thank you very much.